I came across nursing and I found that every day I got to go home and felt rewarded about something that I did today.
I'm so confident in the choice that I made for a major, and it just feels so nice to be so sure of something.
My major in health sciences has really given me the education and the resources that I need to enter the field.
I like that we could go in all different sorts of ways with it. We don't have to stay in one department. We get to be certified in like 4 different departments. We could go to further school and we could go the research route, we could go to medical school, PA, so I really like that with our major.
As someone who wanted to pursue a strength and conditioning concentration to say, I was able to take classes that focused on strength and conditioning principles, the science of strength and conditioning, classes that were able to prepare me as a professional in that field, but also prepare me for grad school.
We take a lot of anatomy, chemistry, physics, physiology, and we also take rehab classes.
The programs are really small, so it's really hands-on learning. There's opportunities to connect one-on-one with professors. There's super small class sizes, and you just get really close with everyone, which makes it easy to network and form connections.
The College of Nursing and Health Science does an amazing job taking care of their students as a whole. What really struck me was that not only my cohort being so supportive, but the advising faculty with the college as well. You know, you'd go in and you'd talk about, oh, how are your classes going? And then it turned into, well, how are you? What are you doing? What are your extracurriculars? And it was really nice that they really took an interest in me as a whole.
My advisors and teachers have really supported me in everything that I want to do and helped me determine which career path is right for me and really helped me pursue those.
Professors have pushed me to apply skills that I learned in the classroom to real-life application. I've learned a lot about autism. All of my research focuses on autism spectrum disorder in children. I've done some really cool work looking at prenatal vitamins and if there is a specific combination of prenatal vitamins that can help prevent the onset of autism.
I've enjoyed my microbiology lab and my blood bank lab experiences. We get to work with actual patient samples. We get practical experience before we get to go to our clinical placements, which is amazing.
Some of my favorite clinical experiences have been in Baird 5 and UVMMC. Both of those rotations taught me to hone the essential skills that a future nurse will need and also how to work with really vulnerable populations such as young kids who have some pretty debilitating illnesses.
It was on the maternity unit with mom and baby, and all of us are just scared out of our minds. We're like, they're telling you to take vitals, and even though you know how to do it, just getting put in that real life situation kind of makes you nervous. But our clinical experiences really are a true test to show you, like, are you in the right place or not? And I think it's only confirmed more and more with all the practical experiences I've had that this is the right place to be.
As an athletic training student, you actually start clinicals your first year. So I remember I was very, very afraid. I didn't know if I'd be able to help with anything. I didn't know if something serious were to happen, what I would do. I was really nervous, but once I got there, everyone was really welcoming. They were teaching me right away.
CNHS really promotes team building and working together and interprofessional collaboration. So while I often find myself working with more people who are undergraduate CSD majors, I work with linguists and people who are studying exercise and movement science and pre-PT students. So we really just all work together to find the best approach.
The community at University of Vermont is really nice. I'm really connected to the Mosaic Center. They work with students of color. Whenever I need someone to talk to about anything, family, school, grades, whatever, I can always go to the Mosaic Center.
The cohorts in your major within CNHS, we're always doing things together, whether it's going to a speech and hearing club and volunteering, whether it's studying together, whether it's just hanging out on the weekends trying to decompress from all those exams and stress. It's a really tight, supportive network, and you make a lot of great friends.
I play on the UVM women's ice hockey team here. Being a student athlete has given me a unique experience. I think it's so cool that I'm an exercise science major and I get to take that to another level, being an athlete playing hockey.
I really like that Vermont has lots to offer outside the classroom.
There are a lot of mountains nearby, and I enjoy skiing and hiking, among other things, so it's nice to have that opportunity. Vermont's also super conscientious about the environment, and I am as well, so they really align with my values in that way.
And as soon as I visited UVM, I just fell in love with Church Street and downtown Burlington.
Vermont is a really unique state to be a young healthcare professional in because it's so small, so everyone just knows everyone. And the healthcare providers in Vermont really want to work with students.
So I had a great internship where I got to work with patients with Alzheimer's, dementia, other forms of memory impairment, and I got to go in and talk to them, form connections with them. I got to get an insight of what it's like to interact with that population and how that disease affects not only the patient but also the family.
I think there's rarely a program around the country or other parts of the United States that offers so much of a detailed curriculum that is very pinpoint. It offers just what we need.
I think that if you're going for the holistic view, if you're going for the real college experience, that CNHS is going to be the place for you. You're going to fit right in.